posterior cervical muscle group. The posterior cervical muscle group lies on the back of the neck and is deep to the trapezius muscle. There are 4 muscles in this grouping: the Splenius capitis, the Splenius cervicis, the Semispinalis capitis, and the longissimus. These muscles function to control the relative movement between the cervical vertebrae and between the cervical vertebrae and the skull. We'll take a look at the muscles here. We have the Semispinalis capitis, the longissimus, the Splenius cervicis, and finally the Splenius capitis. Because of its many components, this muscle grouping has various actions, but in general, it produces neck extension. The upper trapezius, acting bilaterally, assists in neck extension, and the sternocleidomastoid, acting bilaterally, opposes during neck extension. Associated symptoms for trigger points in the posterior cervical muscle group. Clients may complain of pain in the back of the neck or tenderness, pain at the angle of the neck, pain between the shoulder blades, pain at the back of the head, tenderness, numbness, tingling, and burning at the back of the head, painful restriction of neck movement, especially during flexion, and pain in the temple region of the head. Some factors that may activate or perpetuate trigger points in the posterior cervical muscle group include automobile accidents, forward head posture, and poor pillow placement during sleeping. The referred pain from trigger points in the upper trapezius and levator scapula muscles can activate trigger points in the cervical paraspinal muscle group. Common misdiagnoses for trigger points in the posterior muscle group include arthritis and torticollis.